I can do that one.
Graham, are you? Yeah, he's on board. Yeah.
Well, you've been using a lot of electricity today. What's going on?
My thing just burns up.
Group out here. Yeah, the cash out. My goodness.
You have an iPhone? We'll do a hard reset.
Don't do that.
Turn it down, turn it off.
It hit both
Hey, David.
She's trying to do a reset.
reset. Reset both. Oh. Siri. Siri.
Siri.
Oh, I mean, actually, yes, she does.
It's gotta go off and then it'll come back on. Should be resolved.
So you hold this one.
Hey.
That and let it. Yeah, but you have to hold it right. You've got Siri on it.
Is this your first summer here?
This one first.
Are you tolerating the heat
Yeah.
so far?
Together.
Yeah, that's true.
Yeah.
Probably better.
Still back and forth right now, so I get, oh, no.
Oh, are you? When are you moving into?
Probably into July.
Having a lot of work done on it, or is it
We're
brand
gonna go through that process. We close like on the 10th of July.
brand new home? Smart. You know what you're getting into. Establishment. You're in
You do
Lakewood
read
Ranch,
that.
right? You do.
Yeah.
No, you don't.
I'd like to ask everyone to rise for our invocation from Chaplain John Gerhardt.
Thank you, Chairman Carter. Would you bow your heads with me? Lord our God, it is summer. The rains have come and the heat is on. And while many in our community might be traveling or enjoying vacation with family and friends, we who seek to diligently keep this great institution of healing open and operating with excellence and compassion are reminded that Sarasota Memorial Hospital never takes a vacation. We know that our neighbors depend upon us to be there in their times of need, and we ask your help, our God, to make it so. Strengthen our staff, we pray, as they pour out themselves around the clock in the service of others. Deepen our hearts with genuine compassion as we minister with love and grace to the patients and families entrusting themselves to us. And guide us, we pray, in all our thoughts, plans, actions, words, and deeds, that we might truly care for our neighbors as we would wish to be cared for ourselves. These things, together we pray. Amen.
Join me in the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to call to order the meeting of the Sarasota County Public Hospital Board, and I'll read a public comment. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Now we'll I'll start with the approval of the orders of the day, and I think we have an amendment to the orders, Mr. Noonan.
Mr. Chairman, I do have an amendment to the orders of the day. I move approval of the addition of a motion to approve the construction plans for the renovations to East Tower floors 9 and 10 as item 12B1 on the agenda.
We have a motion and a second. Any questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Now, I'll ask for a motion to approve orders as amended.
Second.
We have a motion and a second. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. Now we'll have approval of the minutes of the meeting of May 15th, 2017.
So moved.
Second.
Any questions or revisions to the minutes? If not, the minutes will be approved as presented. I don't think we have any board reports, so we'll move to our presenter today, the cardiac surgery by the numbers from Dr. Jeffrey Sell. Welcome.
Good afternoon.
Good afternoon.
This is going to be a drink from a water hose. So we'll see if we can get through this pretty swiftly. Each slide, although it'll have a lot of things on it, has really mainly one piece of information that I'll point out to you, and some of it will explain. This is just a quick set of things that everybody knows. We don't get a star rating for how good looking the surgeons are, but we do a lot of data analysis. We get a quarterly M&M data report from Columbia as part of the Heart Source program. We talk to them about tough cases. They help us with research protocols, program evaluation, recruiting, and assistance with sizing. And this is just a spectrum of what we do, which is pretty much anything short of transplants and VADs, which are an expensive thing that would require a lot of advanced information for our program. Our program is a growing heart surgery program. That's not a common thing in this country. Most programs are declining by about 2 to 3% per year. We're growing about 15 to 20% per year by case numbers. Our local volume is increasing. Our regional capture is increasing. And we also have a TAVR program that has grown over the past several years. And this is just a diagram. And you can see that the purple is heart cases, how they've grown since 2012. Right in the beginning of 2013. This is a total case chart. Our case mix is actually interesting in that less than half of our cases are coronary bypass. Most programs, 75% are coronary bypass. So we become an intermediate coronary bypass hospital in terms of volume, but a high volume valve program. This is the STS database, and we just received the first quarter harvest, which actually is the data from the full year in 2016. And we'll show you some of what it's based on. This is 4,500,000 cases over a period of time. Each time we do an operation, we fill out about, or our data people fill out about 20 to 30 pages of information on each case that's submitted to the STS. Most programs in the country are involved in the STS because if we want to recertify, we have to track our data on STS. And this is what the data analysis looks like. But I'll pull up this little part here, which just says it's 1,068 programs. In the past year, 291,843 cases entered, 156,000 of which were coronary bypass. Each piece of information gives a sample page that has things like an odds ratio, an observed to expected ratio, which we'll talk a little bit about, STS events, and then charts like this. And we're going to look at several of these charts. Each of these charts show the preceding 3 years for our program, a peer-matched average program, and then the STS average program. It's important to know that in some of these slides, lower is better, and some of these slides, higher is better, and we'll kind of look at that. This is our overall program data. This is in-hospital mortality, and as you can see, our last year's data is way below the national average and the STS average. These are in-hospital and operative mortality, and you can see even our error bars are way, way below the national average for mortality. And we'll just look, this is the sample information we get from Columbia, which is a little different from the STS database, and this is our most recent harvest. So this is actually up to March of 2017. And what you can see is 46% of our cases were coronary bypass grafting. These are all valve cases without coronary bypass grafting, and these are all valve cases with coronary bypass grafting, other complex cases, and a total mix of 737 heart operations. This does not count TAVR. So let's talk a little bit real quickly about observed to expected. If I said I played golf yesterday and shot a 45 for 18 holes, you'd all think I was either crazy or the president of North Korea, or you might also wonder whether I had trouble with the windmill on hole 5. But what that means is that everybody in this room has a concept of what a golf course should allow you to shoot, and we call that par. It's a very simple term. So if a hole's a par 5 hole, and I shoot 4 strokes, that observed to expected is 4 out of 5. That's a birdie. Okay, we do the same thing with heart surgery, except instead of par, we have an expected mortality. So with 4.5 million patients, we can take all of the information, their size, their kidney function, whether this is their first operation, how their heart is functioning, how old they are, lots and lots of information. And we can plug that into a calculator, which actually most of us have on our phones. And we can go up to every patient and say, your risk of life and death in this operation is 3%, 1%, whatever. Your risk of a stroke, your risk of being in the hospital a long time, all those kinds of things. So you like to have your observed to expected, particularly for mortality, to be less than 1. 1 is average, less than 1 is the goal, less than 0.7 is very good, less than 0.5 is very rare, and that's outstanding. So if we're expected out of a certain number of operations that 5 patients would die and 4 do, our observed to expected is 0.8. This is our actual data. So this is, first of all, our complication data, and what we do is when we get this, everything that's in green is below 1, or less than 1 observed to expected, and what you see is actually the numbers are like less than 0.5, 0.26, 0, 0.25. All of this just says that we're doing these operations with a very low rate of complication compared to what's predicted. This is the master number. This is the number that tells you whether you have a good program or not. This is all of the calculatable operations that we do, what our predicted mortality is and what our actual mortality is. And what you see here in the bottom right corner is an observed to expected, that's 0.2. So essentially we got a hole in one on a par 5 hole with this data. And if you actually look up the list, you'll see that some of these we have zeros, less than 0.2, but mostly these are all extremely low numbers. Again, another very complicated slide. This looks at ICU stay. What we find out is that our ICU stays, and here you can see our ICU stay compared to the national averages. So these are the STS median, the dark black line and an error bar, and the blue dot is us. And our lengths of stay for our patients are very low compared to the national average, and yet our patients are very complicated compared to the national average, and we'll see that in a minute. These are length of hospital stay. Again, we're right in the expected range. You see an STS median 6, and our median for that year was 6. An STS median of 7, ours was 6. So these are numbers that say we get the patients, despite their complexity, out of the hospital appropriately. Something that's become very important for us, something that CMS is looking at, is readmission rate. We've tried to address this very significantly, and we've taken all of our readmission rates, which in 2012 were all double digits, and essentially, except for the most complicated cases, which come under the category of other, our last 12 months, all of our readmission rates were under 10%. This is what we call the predictors of quality. And these, again, if we don't meet the number, and you'll see that some of these numbers, for example, use of an internal mammary artery on a case, in order to be at the SDS benchmark, we have to be at 99%. So for the 12-month period, although we have some where we fell a little below, so here we're at 98.7, we're 0.3% off. But for the year, all of our numbers were in the green for the 12-month period. Now we get to what's become a big deal for us, which is the star rating. The STS rates programs 1 star to 3 stars in 3 different areas: aortic valve replacement, coronary bypass grafting, and the combined procedure of aortic valve replacement and coronary bypass grafting. And they look at a bell-shaped curve, and they want your program to be outside of the region in order to get a higher star number or a lower star number. So this just shows you our composite score for coronary bypass grafting. This is the STS mean. This is where we came in the mid-90th percentile, and our rating number was about 98.5, and that's in the 3-star range. Let's look at how we did that. This is one of the slides. I pulled these charts out of the individual slides, and this is just looking at patients who have chronic lung disease of any kind. So about a third of our patients, compared to about a sixth of the patients in the national average, have chronic lung disease. Again, 50% roughly to 60% of our patients have congestive heart failure when we operate on them for coronary bypass grafting, as opposed to 20% for the national average. Age, of course, for us, the average number of patients, percent of patients over the age of 65 is typically about 55%. For us, it's 74% of our patients over the age of 65. This is length of stay. This one is good. This is the percent of stay under 6 days. And this one, low is good, percent less than 14 days. So again, short length of stay, not a lot of long length of stay, despite a higher risk population. This is something that I think is really interesting for our program. We have 100% referral of our post-op patients to cardiac rehabilitation, most of them to our own center. There's a lot of data that says that this, in fact, it's so much data that the CMS is now, Medicare is now paying for cardiac rehab because it makes such a difference in these patients' recovery. This is the AVR overall rating for just aortic valve replacement, again, a 3-star program. This is our in-hospital mortality for aortic valve replacement, and you'll notice that in 2015 and 2016, it was 0. This is our cross-clamp times. This is a measure of how efficiently we do the operation, and you'll notice that the national average is somewhere between 65 and 70 minutes, and we're mostly below around the 55-minute range. And again, total time on the heart-lung machine, not something we like. Both of our 2015 and 2016 data significantly below the national average. So these patients are getting short periods of time on the heart-lung machine. We stop the heart for a short period of time, and yet we have 100% survival. This is the combined coronary artery bypass grafting and aortic valve replacement. Again, 3 stars. And again, in hospital mortality for these procedures, which are very complicated. It's a combination of bypassing arteries and replacing a valve. Again, no mortality. This one over 3 years. And then this gives you a sense nationally how we compare. So to have 3 stars in coronary bypass grafting and AVR like we do, we're one of 25 centers nationally out of 1,017. AVR plus CABG, we have 3 stars versus CABG. There are only 23 nationally. AVR plus AVR CABG, there are only 20 nationally. And really the important thing is to get 3 stars in all 3 areas. There are only 14 centers in the country that have been able to achieve that level of success. So things we're working on, obviously we brought our 4th operating room, which had been used as a robotics room and everything else. That's now back online. We've got our nursing staff mostly back up to the level. We have gotten technician support on the anesthesia side, so we have improved case flow. We meet every Monday and Friday as a team to go over every patient on the service and talk about the cases, so we have a really good approach to making sure our patients get the best possible operation with all our heads put together to decide that. We have a closed section so that we avoid doctor shopping. And we have a good quality product with a high complexity and excellent outcomes with good numbers. So those are the 3 things we can do: numbers, quality, and high complexity that make for good program. So for all of us on the cardiac surgery side, we have to say we really appreciate the support of the hospital and the board to make it possible for us to be able to practice at this very high level of outcome for a program. And thank you again.
Thank you very much, Dr. Sell. It was a great report, and we thank you for what your team does. Appreciate it. And we have the Hero Hall of Fame. David?
So before I get started on this, I just want to thank Dr. Sell from behalf of the hospital for everything that you've done. I had the privilege of being here when we recruited Dr. Sell and brought Columbia in. And I got to tell you, the reports that we see today are nothing like they were back in those days. And our patients and our community very much benefit from all your leadership. Absolutely. So thank you. Okay. Now can I do the hero?
Yes.
Okay. So I would like to announce our Hero Award for June of 2017, Dr. Juliet Coleman. Dr. Coleman, can you come join me? I see you brought a fan club back there, too.
My husband and granddaughter. Thanks.
Come stand by me up here, will
Okay.
you? Make me look good. So Juliet Coleman is our Hero Award recipient for June. She's a board-certified neurologist and first physician group neurohospitalist. Dr. Coleman was at CrossFit class when a woman in the gym became dizzy, sat down, and vomited. Immediately rendering assistance, Dr. Coleman noted that the woman's right side weakness and diminishing consciousness. After facilitating the 911 call, Dr. Coleman convinced EMS to transport to Sarasota Memorial's Comprehensive Stroke Center. She accompanied the patient to our ECC through our stroke alert protocol and on to critical care following endovascular therapy. As we know, time is brain. When the stroke is suspected, Dr. Coleman performed heroically to ensure the patient's individual needs were addressed quickly and effectively. We're happy to report the patient is alive and well and with minimal defects from the stroke. She did indeed suffer. Thank you, Dr. Coleman, for your 24/7 commitment to everything. We so much appreciate it.
Dr. Coleman, on behalf of the board and staff at Sarasota Memorial, this is a beautiful plaque, Hero Hall of Fame, and if I may read it, the hospital board and administrative staff of Sarasota Memorial Healthcare System hereby inducts Dr. Juliet Coleman into the Team SMH Hero Hall of Fame for actions that capture the essence of a true hero, including courage to have persistency in the face of fear, passion to always do the right thing, integrity to have a strong moral compass, and concern to have a concern for the well-being of others. Signed by David Verinder, President, CEO, and our Chairman, Greg Carter, Chair of the Sarasota Memorial County Public Hospital Board. Congratulations.
Thank you.
You get to keep
Yes, you keep it this time and talk.
But, oh, wait. Why don't you have your husband come on up? Oh, come on. You don't want to shoot from the other direction?
Okay.
Perfect. You have to give a speech.
Oh, gosh. So I've been here at Sarasota Memorial about a year and a half, I guess. And I can tell you that I love it. I had a practice and worked for Gulf Coast Medical Group in Venice. And that's where I was at the CrossFit class at 5 a.m. I think it was February 15th or 16th. And so the EMS people who arrived, of course, were going to take her to Venice Hospital. And I said, I'm a neurohospitalist, and a stroke specialist over at Sarasota Memorial. And I was already in contact with the rapid response team here. And I said, do you mind taking her to Sarasota Memorial? And they, okay. So hopped in the truck with them and came here and had the TPA all set up and ready to give. And I tell you, I could not have done that anywhere else. The rapid response team here and the way they have the protocol set up in the ER, and I guess the stroke committee and Dr. Concha is responsible for that. But had it not been so easy to deliver information, I called Michelle, the rapid response nurse who was on call. We all are in contact by text and everything. And, so that Dr. Garby was in the ER, and I had it all set up. We're going to stop briefly, but I'd already talked to him and told him the symptoms. And she got IV TPA within 20 minutes, which was a record-breaking time for the hospital, and then went straight to interventional therapy. Is that my fan club?
It was.
Went straight to the interventional therapy, and Dan Case pulled out a basilar artery thrombus that was had filled the whole basilar artery. So she would have died had it been 10 or 15 minutes later or 20 minutes later even. So I'm proud to be a member of Sarasota Memorial, because you're right, they help you deliver that care. So.
Our next item is the report of the medical staff. Dr. Scott Stevens, Chief of Staff.
I have nothing new to report. Thank you, sir.
Okay. Our foundation report, Mason Ayers.
Thank you, Mr. Chair. Got a couple things to report this afternoon. First of all, we just closed our employee giving campaign, and I'm happy to report that we saw a 30% increase in the amount of funds given by the employees in the campaign. And also we had a 19% increase in the number of employees participating in the campaign. Big thank you goes out to the SMH employees that participated with gifts, also those that were chairing the campaign, as well as our foundation staff. It was a great success, and we're starting to put plans together for next year's campaign. Also wanted to give you some dates to put on your calendars for events coming up. On October 12th, we're going to have the 12th annual Key to the Cure event with Saks Fifth Avenue at Saks. We also are going to have our Hospital Gala first year event on January 13th at the Ritz-Carlton. And our 6th annual Women in Medicine Luncheon is going to be held on March 23rd at Michael's on East. And then finally, the 17th annual Foundation Golf Tournament will be on May 4th at Laurel Oak Country Club. That concludes my report, Mr. Chair.
Okay, thank you very much. Secretary's report, Mr. Tram Hudson.
Mr. Chairman, I'd like to call to the attention of the board and the general public, there will be 2 meetings in July. Our first meeting, want to invite folks for the Newtown Internal Medicine Practice grand opening and ribbon cutting will be held at 1 p.m. On Monday, July the 17th, we will have a series of committee meetings. In addition to the board meeting, at 9 o'clock, the Finance Committee will meet. At 10:30, the Quality Committee will meet. We will conduct peer review at 12 noon, break for lunch, and discuss our financial review from 12:30 to 2, and at 2 p.m. we will have our board meeting in this room. And those are the meetings for the month of July.
Thank you, Tram. Next is our treasurer's report, Mr. Jim Meister.
Mr. Chairman, thank you. I move approval of the bad debt and charity care for the month ended May 31st, 2017, in the amount of $17,084,000.
I second that.
We have a motion and a second. Any questions, comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. Next, we have financial highlights from our Chief Financial Officer, Bill Wolgen.
Thank you, Mr. Chairman. I have the financial highlights for May, and this is the 8th month of our fiscal year. So the fiscal year to date represents 8 months. Fiscal year to date numbers represent 8 months of activity. Starting with operating revenue for the system, for May, $73,519,000 compared to a budget of $60,442,000. Fiscal year to date, $524,833,000 compared to a budget of $490,453,000. For the system total expenses for May, $61,313,000 compared to a budget of $60,593,000. For fiscal year to date, $488,620,000 compared to a budget of $482,977,000. Looking at operating income in the rating agency format, for May, $15,234,000, which generated an operating margin of 19.6%. This compares very favorably to the budget of $2,944,000, which was an operating margin budget of 4.6%. Fiscal year to date, operating income of $60,193,000, which generates an operating margin of 10.8% through 8 months, compared to a budget of $32,233,000, which is an operating margin budgeted at 6.2%. These are year-to-date statistics for the hospital, so 8 months of activity. Our average daily occupancy, 495 patients, compared to a budget of 495 patients. The acute length of stay on average, 4.5 days, compared to a prior year number of 4.67 days. Admissions through 8 months, 22,753, compared to a budget of 21,355. Hospitals' surgery cases, again, these are year-to-date numbers, 15,144, compared to a budget of 15,034. Births, 2,288, compared to a budget of 2,278. Through 8 months, our outpatient registrations, 300,398, compared to a budget of 302,986. And the emergency care center registrations, 84,180, compared to a budget of 86,907. Our case mix index through 8 months for all patients, 1.89, and for Medicare patients, 1.99. Mr. Chairman, that concludes my report unless there's any questions.
Okay. Thank you, Bill, very much. Now we'll move to committee reports, and we'll start with the Human Resources Committee. Tram Hudson.
Mr. Chairman, the Human Resources Committee met this morning. We had 2 agenda items to go over. First, Laurie Bennett, Executive Director of Human Resources, presented the State of Talent Report to the Board and Committee. Ms. Bennett opened the presentation with an overview of the influences on the workforce over the past decade. The current state of our talent, including demographics and turnover, was detailed. HR strategies, efforts on recruitment, education and development, and retention were also outlined. And lastly, our outstanding FY 2017 Gallup report results for employee engagement and next steps were shared and discussed. The second item on our agenda this morning was a review of our charter to orient new board members and committee members and to respond to their questions. Specifically, we talked about the process that we will use later this year to review the compensation and performance of our CEO. That's all I have to report, Mr. Chairman.
Thank you very much. Mission and Planning Committee, Mr. Bill Noonan.
Thank you, Mr. Chairman. The Mission and Planning Committee met earlier today, Monday, June 19th, 2017. Lori Lang, Chief Operating Officer, and Tom Perigo, Director of Architecture and Construction, presented the plan to renovate 9 and 10 East Tower after the opening of the new rehab pavilion. Lori shared that this project is directly tied to the private room strategy referenced in our strategic plan. She reviewed the impact and benefits that will result from the project and the timeline. Costs associated with this renovation were examined in detail over fiscal years 2017, 18, and 19. Therefore, I have a motion. I move approval of the planned renovation of East Tower floors 9 and 10 for a total project cost not to exceed $17.7 million to be budgeted as follows. FY 2017, $8 million as budgeted and approved September 2016, with any unspent balance to be moved to fiscal year 2018. For 2018, $6 million, and 2019, $3.7 million, as recommended by the Mission and Planning Committee.
Second that.
We have a motion and a second. Any discussion or questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much.
Thank you. Next, Lori Lang, Chief Operating Officer, and Charlotte D'Amato, Lean Six Sigma Quality Coach, and David Patterson, our Associate Chief Nursing Officer, presented to the Mission and Planning Committee an update on Sarasota Memorial Hospital's capacity project. Ms. Lang opened the presentation with an overview of the hospital's capacity challenges, in particular illustrating the bed capacity constraints for fiscal years 2013 through 15. The SMH board had previously approved $2.7 million in July of 2015 to improve bed and operating room capacity. This capacity project was planned in FY 2015 and then implemented across fiscal years 2016 and 17. The project focused on 4 categories of improvement: infrastructure, technology, process, and people. The initial phase of the project proved to be very successful and decreased the discharge duration time by 110 minutes, or a 33% improvement, and also decreased ECC admission time by 46 minutes, or a 31% improvement. In 2017, the capacity project focused its attention on improving operating room efficiency and creating additional OR capacity. The plan was to redesign the surgical services processes, install the Orchestrate software, and create communication in real time for meaningful data to all parties involved in the OR process. 3 goals were established: to reduce the number of late starts for the first surgery cases of the day, reduce turnover between cases, and finally to improve OR utilization. Ms. D'Amato presented a day in the life of the OR, both pre and post implementation of Orchestrate, the teletracking software. David Patterson continued by presenting preliminary results from the project. Percentages of on-time starts for first cases of the day have improved by 77%, from a baseline of 39% to most recently 67%. Turnover has also improved from a baseline of 33 minutes to an all-time low of 26 minutes. Overall utilization of the OR improved from a baseline of 48% to 54%. The next initiative is to provide surgeons a mobile app so they can be informed real-time on patient and OR status of cases and rooms. Mr. Patterson advised that the Orchestrate system is scheduled to be deployed in radiology in December 2017 and then implemented in the cath lab and endoscopy areas in 2018. That concludes my report, Mr. Chairman.
Thank you, Bill, very much. Now we have our President's report from our President and CEO, David Verinder.
Thank you, Mr. Chairman. Let's start off today, as we always do, with our organizational report card for the month of, this is year-to-date through the month of May 2017. We look at our HCAP scores, and we have a goal of being 8 out of 11 at or greater than the 50th percentile. We are a little bit short of that right now. We're coming in at 7 out of 11. On the outpatient side, we have our number of domains that we look at that are at or greater than 50th percentile. We have a goal of being 55 out of 58. Happy to report that we are trending very well. We're at 57 out of 58, so actually improved a point since last month. In the people pillar, we look at our turnover of part-time and full-time employees within 12 months of hire. We have a goal of being at 25% or less. We're slightly over that right now. We're at 25.19%. And we had a robust discussion about that, as Mr. Hudson just reported on a minute ago this morning. In the quality pillar, we have infection prevention, which is our combined overall standardized infection rate. We have a goal of being below 0.95. Happy to report we are considerably below that at 0.89. National or expected average being at 1.0, so really leading trend there. The finance pillar, we have an organizational finance, our operating margin, as our CFO, Bill Wojcik, just reported. We have our goal or our budget of 5.1%, and we have an expected margin this year, 8.4, so we're exceeding that. And in a growth pillar, we have our first one is our inpatient admits and observation outpatients. We have a goal of 38,899. I'm happy to report we are exceeding that at 42,489. And we also have a goal of outpatient registrations at 799,000, but we're projecting a little bit short of that right now at 786,601. Looking at our HCAP scores a little bit more closely, we are still finding our challenged areas that we have seen throughout most of this year. And you can see them right in the middle of the report, the 4 areas that we continue to put a good bit of staff focus on around responsiveness of hospital staff, which we're 2 points shy of, communications with physicians we're 1 point shy of, cleanliness of a hospital environment 1 point shy of, and quietness of the hospital environment, which we're a good bit below on 6 on. I can report that we do have staff focused on all these areas continuously, as well as the ones that were in green, because if we don't keep the focus there, we slip on that as well. And I would just caution members of the public, we do have quite a bit of construction going on right now. We're doing some renovation work around the hospital, really trying to move the cleanliness score. So if you bear with us for just a little bit, we will be out of your way soon. Earlier this year, SMH held our annual service anniversary celebration honoring dedication and contributions of hundreds of employees, marking anywhere from 5 years to incredible 45 years of service within our organization. The event started out with a ceremony in the auditorium to recognize and reminisce with our honorees, followed by a special reception with friends, family, and coworkers. Several board members were in attendance. We appreciate your being there, and here's a couple of pictures from that event. Staying in the people pillar, we are helping our teams pursue careers in healthcare. So the Sarasota Memorial Healthcare Foundation, funded by an SMH Auxiliary Endowment, recently awarded the 2017 Duncan Finley Health Career Scholarships to our 4 outstanding high school students who plan to pursue careers in healthcare. Each student will receive $10,000 to help offset the cost of college tuition expenses over the next 4 years. The annual scholarships are awarded to students who participate in detailed written application and interview process in which they demonstrate a commitment to pursue a career in the medical field, strong academic performance, and economic need. So we first off always thank Dr. Finley for his continued support of the program, but also and the foundation as well. Mason, thank you there. But certainly congratulate our 4 winners this year of the scholarships. It means a lot to those kids. So Sarasota Memorial also had honored area athletes at Herald Tribune Best of Preps this year. So at Sarasota Memorial, we're all about health and safety. Over the years, it's been our privilege to provide medical care and rehab therapy to hundreds of student athletes, whether overcoming injuries sustained on the field or battling medical conditions that sideline them for a season. There's nothing more rewarding than seeing them successfully return to play. That's why we were proud to present Steve Bennett with the 2017 Athletic Trainer of the Year Award at the Best of HT Prep ceremony this year. It was a pretty interesting night. It was a very full auditorium. I think they were all there to see me present that, but then Derek Brooks got up and talked, and I realized maybe it wasn't me. So we had our own SMH chief honored by Intergovernmental Service Award, and Mickey didn't know I was going to do this today, but he's sitting in the back of the room, I'm sure, cowering down about right now. Turning red, or was that from fishing? Yes, okay. So on May 8th, 2017, Chief Mickey Watson, our SMH Chief of Public Safety, was presented with the inaugural Intergovernmental Service Award by Sheriff Tom Knight of the Sarasota Sheriff's Office. This award recognizes intergovernmental collaboration and cooperation above and beyond the call of duty. Sheriff Knight detailed a number of incidences where Chief Watson and his public safety department staff had reached across governmental lines in the best interest of the citizens of Sarasota County. And you really can't see it from this picture probably too well, but there's a trophy the size of a real eagle. And where did you do with that, Mickey? It's in your office on your desk. It would take up the whole desk. So anyway, congratulations. Moving into quality, SMH was named Center for Excellence for Hip and Knee Replacement. Sarasota Memorial has been named as Center of Excellence for Hip and Knee Replacement by the DNVGL Healthcare USA, Inc., one of the nation's leading hospital accrediting organizations. The prestigious certification recognizes the hospital's excellence in orthopedic surgery within the scope of hip and knee replacement and related procedures. The certification process included a recent site visit from a DNV surveyor and a comprehensive review of the Sarasota Memorial's procedures, quality, indicators, and patient outcomes ranging from mortality to readmission rates to prevention of surgical infections and complications. Patient education and pain management were also assessed. So congratulations to our team there. Staying in quality, Sarasota Memorial's Nurse Residency Program recently received accreditation with distinction from the American Nurse Credentialing Center. The innovative program provides newly licensed RNs with experience, expertise, and support as they begin their nursing career. SMH's program is one of only 2 in Florida and among 10 across the United States to achieve this special national recognition. According to the ANCC, research suggests that residency programs can reduce nurse turnover, increase job satisfaction, and improve clinical competence, which ultimately impacts safety and quality outcomes. Continuing in the quality area, last month, Sarasota Memorial conducted an emergency drill to test the hospital's capacity to care for a large influx of patients and evacuees following a hurricane. The scenario called for a surge hospital to be set up in the south parking garage for residents evacuated from the SMH Nursing and Rehab Center on Clark Road. Patient care clinicians, SMH's public safety team, nursing and rehab staff, and personnel from registration, operation of plant, marketing, and other departments participated in the training exercise to help ensure the hospitals are prepared for mass casualty situations. And just in case we haven't talked about our security department enough today, staying in quality, congratulations to the SMH Public Safety Department, which has been recognized in Security Magazine's 2016 Security 500 rankings as one of the best managed security organizations in the world, all sectors. The ratings are based on a number of factors, including staffing, training, equipment, IT, security infrastructure, organizational commitment, and accreditation. It's the 3rd time since 2012 that SMH Public Safety has been honored with the Security 500 Award. In 2016, the department was ranked number 26 in the healthcare sector, joining other major health systems, including New York Presbyterian and Mass General. Kudos to everyone in the department for their outstanding efforts in keeping the organization safe and secure. Feeling the love, Mickey? Okay. We, as always, have a number of different programs going on, free programs for the public to go and learn about different healthcare conditions. I would invite everyone to go to our website and take a look at these. But it's quite a bit of them coming up in the next month, so I would invite everyone to take a look. And going into growth, Sarasota Memorial is known for high-tech robots and medical devices spread across our expansive 1.5 million square foot medical campus. Now the first hospital in the nation to deploy an innovative geomagnetic wayfinding app powered by the Earth to help people navigate the multiple towers and myriad hallways. Unlike GPS systems that rely on satellite signals and don't work indoors, the SMH Wayfinder app uses the digital compass and sensors inside smartphones and the magnetic footprint found inside buildings to help people pinpoint their exact location indoors and easily find their way to their destination. And I would just echo that, first off, anyone in this room, plus the public, go on the Apple Store. It's a free download the app. Use it when you come to Sarasota Memorial. We certainly have the people that are here to help you wayfind if you're not using that, but we find some people want to do it on their own, and that'll help you. When we did the press announcement, we gave the press the download, and they found their way to the meeting room we were doing it in without assistance, so which would have made the whole press conference a little different had they not. So, staying in growth, we are proud to announce that the opening of our new Sarasota Memorial Internal Medicine practice in Newtown for July 5th ribbon cutting. It is something that I know everyone has been very focused on and working on for years now. It is where our new internal medicine residents will begin their training, along with our senior staff that are providing their instructional abilities and expertise. It is at 1825 Dr. Martin Luther King Way in Sarasota on July 5th from 1 to 2. So welcome to anyone in the community to come out. And Mr. Chairman, that is my report, unless there's any questions.
No questions for David? Okay, thank you very much, David. I don't think we have any items on our consent agenda, so I'll defer to Karen. Public comments? No, sir. Okay. Legal matters, Carol Ann Kalish.
I have no report.
Okay. Does anyone have any other business? If not, then we are adjourned. Thank you very much.
We timed it pretty well.